They're going to start with a brief introduction or rundown from everybody, and we have Dr. Cliff Robertson on the call, our CEO. We have Dr. Carrie Ward on the call, our Chief Medical Officer, and we have Julie Gurnutsky on the call. She's our Division Vice President of Operations for CHI Health Clinic and the Physician Network. So we'll go ahead and start with Dr. Robertson, and he can give us an update on where we're at with COVID numbers.
Thanks, Taylor. Good afternoon, everybody. This morning, as of Monday morning, we had 155 COVID positive patients across the CHI Health hospitals. That's down from about 170 where we were the last time we met on January 5th. So we continue to see that slow downward decline. One of the other things that we watch, and Taylor, if you can pull up the test positivity graphic, that'd be great. One of the things that I watch every day is the percentage of tests that are run in our lab that are positive. That's the second one, not that one, that's the employees. The reason it's important is because this graphic is, or the percent positivity, this graphic here is really a leading indicator, if you will. So again, this isn't all of the tests run in the state. These are just coming out of our labs in CHI Health. But you can see that back, early November, we peaked in terms of the positivity. We were over 30% of the tests were coming back positive. In fact, had one day above 35%. But since that time, we've seen a relatively steady decline to now we're down in the 15% of the tests on a daily basis on average are positive. If you think about it, and we've mentioned this before, what we know is that the hospitalizations occur somewhere between 17 and 20 days after people are infected with the virus. And in fact, in our experience, our peak, meaning the number where the day that we had the most patients hospitalized with COVID was back on November 23rd. And that was, 20 some odd days after we went through this little peak of positive tests coming out of our lab. So I just wanted to share that with you all because this is what I watch. This is what we look to be able to give us an idea of what's in front of us over the next 20 days or so. A couple other things, just quick updates. We continue to vaccinate our staff. We expect we'll be done vaccinating about 80% of those who have signed up by the end of this month, so in the next couple of weeks. That won't be 100% of our staff. We can talk about that later, but it is a substantial number. In fact, the number as of today is we've vaccinated out of CHI Health 10,247 individuals. So those are both our employees, first responders, medical staff, physicians and offices that care for patients in our hospitals. Of that 10,000 number, about half of those, a little over 5,000, have already received their second dose. So that just gives you an idea of how many folks are now on the path, at least how many caregivers are now on the path towards immunity. And last I'll just comment on is, we've updated you on reactions to the vaccine. We continue to have nothing significant to report. Again, people will have sore arms, rare case, people might feel fatigue or flu-like symptoms for a day or so. One of the things that I've heard over and over again from our staff that have been vaccinated is that the symptoms after the vaccine seem to just go away. It's like 24 to 36 hours, and all of a sudden, folks will report their arm isn't sore anymore. So that's where we are with the vaccine. I think I'll turn it over at this point for actually more information on the vaccine to both Carrie and Julie. So Carrie, if you want to start.
Hello, everybody. Hi, I'm Carrie Ward. Yeah, just real quick, let you know as much as we can, as much as we all know right now about our status of the vaccine. As Cliff said, we're having a very nice, smooth course of vaccinating all of our employees and others, and we're all anxious to get to the phase 1B. We think that we will have everyone vaccinated within a few weeks and ready to move on to the phase 1B. Much of what we want to do will be predicated on how much vaccine we get. And we're talking every day to health officials at the county level, at the state level, to try to help determine the best way to do it. So right now, the state's going to get about 23,000 doses a week. They're working with the health departments to figure out how best to distribute that. And we have several plans in place based on how much vaccine we actually receive in each of our regions. And it's very specific to the different health departments. So every one of our divisions and areas are just a little bit different how we're approaching it. So like in Lincoln, for example, we're partnering with other health systems there. They're going to use the Pinnacle Bank Arena. Friday, they're going to be dosing, and we're going to be lending staff to that effort. Right now in Omaha, it depends on the number of doses we're going to get. Julie's going to tell you more in a little bit about sites that we may have that we're going to have to do this, but we also will be ready if we get a chance to do some sort of similar mass vaccination in Omaha. So again, we're working very closely with state officials, local officials to determine how best to get this next group of folks vaccinated. Julie, you want to talk about kind of what we're doing from the clinic standpoint?
Absolutely. Thank you, Dr. Ward. I'm Julie Gronetsky, and we have a wonderful team that has come together to put a plan together for our patients. So we have identified 4 Omaha metro area plus Lincoln hospitals to be able to provide clinics for our patients. And one of the reasons that we chose the hospital setting was actually multifold space, the workflow. We want to make it convenient for our patients. We don't want you to have to wait in lines, as an example, parking and more. So we'll have 3 of those in the Omaha metro area, and again, 1 in the Lincoln area. The patients that we'll be working on, as Dr. Ward referenced initially, will be the phase 1B patients. So patients 65 and older, or patients that have a pre-existing health condition. We have already identified our patients that fall into those categories to be proactive in this planning process, and we will be making sure that once we are a go with this plan, that we have multi ways to be able to reach out to our patients. So either via the patient portal, I recommend our chihealth.com website, where that will have the most up-to-date information as it comes out, and other methods to be able to connect to our patients. The famous question, again, is how many doses will we be expecting? We are going to over-predict. We are excited to be able to vaccinate our patients and partner with the counties and the state for our communities. So we want to be overly prepared, and we will be ready to do that. We do ask for patience. This is definitely a moving plan, but what I appreciate about our team is the resiliency, because we definitely want to partner with our counties and our state in the best method possible in working together. So we appreciate the patience that our patients have had with us as we work together and solidify our plans.
Awesome. Thank you, Julie. And we're going to jump right into those questions that we got. This first one I'll ask of Dr. Robertson. It has now been over a month since vaccines have been administered at CHI Health. Are less staff getting sick, and what changes have you noticed in the health of staff, if any?
So you can pull up that other graphic now, because that's the one I wanted to share to answer this question. But what we're seeing with our staff is what we're seeing in the community. As the rate of community spread has declined, so has the number of staff that we have out on any given day, you know, either because of exposure and in a quarantine mode, or out ill with symptoms. And so you can see back in early December, we had, you know, a little over 200 employees, staff. These were staff people of all types. These aren't just clinical staff. This includes administrative staff as well, that were out, and that number has declined to 34 as of yesterday. That you know, makes up the 200 is well, it sounds like a large number, is a tiny fraction of our total workforce. You know, it's in the 1%, 1.5% range, and we've been very blessed through this pandemic to not have experienced what other health systems have experienced, where they've had, you know, thousands of staff, you know, hundreds at least, if not into the thousands of staff out at any given time. We've been blessed through this period.
All right, next question is also for you, Dr. Robertson. Have most of the staff received their second vaccines, and what percentage of staff have refused the vaccine?
So 2 questions. So we've given second doses to about 5,000 of that 10,000 that I reported earlier. So we still have a few thousand of folks that have received dose 1 that are waiting for their booster dose, either 21 days or 28 days, depending on the vaccine. What we believe is that we will see somewhere between 60 and 70% of all of our staff getting vaccinated in this first go around. The question that everyone asks is, why isn't 100% of the staff getting vaccinated? And I'll tell you anecdotally, because we don't have this data all correlated and collated, but anecdotally there are groups of people, either they've had COVID and they're like, I don't know that I want to get the vaccine, I've already had the virus. So that's one small subset. There's also groups of folks that are just leery. They want a little bit more time to pass before they decide to get vaccinated. And in fact, in some of those folks, I've had people tell me they're waiting for the next vaccine to come out, either the J&J or the AstraZeneca, which were built on more traditional platforms. And so that's another small subset. There is a small subset of women that are in childbearing age years that are thinking about pregnancy and have decided that they're just a little unsure of whether or not to get the vaccine right now, even though we've done our best to educate folks that there is data that came out of the trials that didn't seem to demonstrate any concerns relative to pregnancy. The point is there's not a lot of data out there yet, and that's what I think some folks are waiting for. And then I think there's a small group of folks that have vaccine hesitancy. They just don't trust. They don't like vaccines anyway, and that's probably the fourth group that has opted to decline. My guess is over the next month or two, as more education occurs, as more time passes, for those of us that work in healthcare, I'm guessing we'll get north of 85% that'll ultimately be vaccinated. That would be my expectation.
Thank you, Dr. Robertson. Dr. Ward, when do you think CHI Health will begin vaccinating the next phase for 1B?
We're ready to do that right now. We have a lot of that is just dependent on how much vaccine we get. I want to say, Julie, you heard her team, the teams that have put together these vaccination programs have just been amazing. We've been giving thousands of doses a day, just incredibly smoothly. We are ready. We're ready as soon as we can get the vaccine and all the okays to do it. As Cliff said, we think within the next couple of weeks we will have all of the 1As done. And we also heard from the state and county officials today that the 1As, the long-term care facility patients, they expect that all of those will be completed by the end of the month too. So we're all ready to move into 1B here within the next few weeks.
Julie, who will CHI Health be responsible for vaccinating? Patients only, the general public? Can you expand?
Absolutely. I would say yes and yes to both of your questions. We recognize that details are constantly changing, and we are absolutely following the state's lead and partnering with the many counties. Right now, we've been asked to support our own Phase B patient population, but like I mentioned earlier, we are absolutely ready to collaborate with the many partners to ensure we're taking care of our patients and the communities as well. There's going to be different ways of being able to schedule. So as we continue to work through these logistics, that's where we'll make sure to communicate in different forms to ensure that we're providing a great experience for our patients.
And this next question was asked by a couple people, and I'm going to combine one of them. Can you release where CHI Health will have its vaccine sites for CHI Health patients, and what hospitals will be used for vaccinations?
Yeah, absolutely. Like I mentioned, we will have 3 Omaha metro area locations in our hospitals for Omaha Metro, and then 1 in Lincoln. The Kearney, Grand Island, and rural areas, they're already working closely with their counties in regards to their local plans at their hospital locations as well. So as we get to the point that we've completed our final logistics, we'll be excited to share exactly where those locations will be in the Omaha Metro and Lincoln. So more to come soon.
Can you talk a little bit about how the process will work for people?
Great question. So we're still working through that. Again, we want to learn more about what the counties are doing. On our end, if it works through our scheduling process, we will want to have scheduled appointments. There is reasons for that, is we don't want our patients waiting in line. So we want to be able to provide an efficient process so that when they go to their location to receive the vaccine, it's smooth, they're not waiting a long period of time, and it's organized. So we will want to ensure to communicate what that process will look like so that patients can schedule those appointments at the location convenient for them.
And then when and how will patients be notified that they qualify or can sign up, Julie?
Yeah, great question. We will continue to communicate what that's going to look like. It can come in many different forms, again, through the patient portal. We, again, really encourage going to the CHI Health website as an example to get the most update information. So we'll continue to update that timely because, again, it can change by the hour as this cross-collaboration is occurring across the state. And we want to be able to provide that great experience for patients to make it convenient too. So that'll be a great place to start, but we look forward to communicating out more here in the near future.
Dr. Robertson, I'll ask this next one of you. Once CHI Health vaccinations move beyond its workforce into the patient population, do you know how many doses CHI Health will have available weekly?
You know, I don't know that we know that number yet. Dr. Ward might be able to give you an idea, but if the state is going to receive some 20,000 or so doses on a weekly basis, obviously we would have a subset of that. Carrie, do you know? Have you heard anything?
No, I don't know any more than you said, Cliff. It's a very fluid situation. We're just waiting to hear from the various county health departments based on the doses that they have to use and exactly how they want to use the hospital systems, the pharmacies, FQHCs, and others. So no firm numbers yet.
Dr. Ward, how long will it take to get through the next phase, and does adding individuals 65 and up make this process longer?
Well, of course, how long it takes depends on how much vaccine we have. You know, there's no doubt when we added the 65 and then also those with comorbidities that are below 65, I think we've all seen the estimates are about 400,000 people in our state will now be eligible for vaccination. So that's one of the reasons why Julie and her team and all of us are putting all these efforts together, because if we do get a large amount of vaccine, we want to give it right away. Every dose that we get every week, we want to be in somebody's arm by the end of that week. So that's our goal. So it's just dependent on how much we can get.
Julie, how will you be managing the vaccine sites to ensure they are safe for people in terms of social distancing, mask wearing, et cetera?
Yeah, great question. So we've already been doing this for a while for our employees. So we've set up a great practice in how we set up our clinics today. So we've learned a lot in that process, and we follow high quality standards in putting these practices into place. So as we transition to taking care of patients, we will absolutely make sure those high quality standards are in place and that they're taken care of through our vaccine clinics. So we look forward to seeing them.
Julie, do you anticipate long lines and hours of waiting, or how do we plan to avoid this?
No, I mean, our goal here is to not have patients wait in line. So that will be the importance of setting up appointments and also making it easy for patients to set up appointments. So there's many different ways that we're looking into that to help our patients, whether it be by phone or online even. So we want to make sure that we put the right scheduling practices in place so that we prevent lines from happening.
All right, next one I'll ask of Dr. Robertson. Have you seen the new variant here in Omaha or Nebraska in general?
You know, I don't believe we know whether or not we've seen it or not. You know, I think folks just generally assume that if it's somewhere in the country, it's probably, you know, somewhere else. It's probably spread to other locations in the country. Our lab doesn't specifically do the genetic testing to be able to determine the variants. So when we test somebody who tests positive for COVID, it would be it would be for any of the variants of COVID that may be out and about worldwide. So long way to answer the question. We assume the variant is around, but at this point, it doesn't change how we treat people, both from a therapeutic perspective or from the perspective of who gets vaccinated or needs to be vaccinated.
Moving on to questions in the chat now. I've heard that Lincoln and possibly Omaha have not gotten as much vaccine per capita as other areas of the state. Are you experiencing that, Dr. Ward? Do you want to touch on that?
I do not know the exact number per capita across the state. Obviously, we all want more everywhere. So we're all giving all that we can. And I've been so impressed with the state leadership. With what they've got, they're doing their very best to work with all of us to figure out how best to distribute it. So there's good reasoning behind a great collaboration with all of the health systems, health departments, community coalitions to help determine the best way to distribute it. So I am confident in the process.
Okay, thank you. And then this one will also be for you, Dr. Ward. A couple questions, so I'm going to try to combine them. Can you tell us more about the mass vaccination event in Lincoln on Friday? Who will get the shot? Do they need to sign up? And are those for phase 1B?
Well, I don't know if anybody else on the call can help me out with that. I can certainly defer to some other people for some questions after this, but I don't know exactly the process. I do know that these are 1B. They've signed up through the health department, and it's a combined effort that St. Elizabeth staff and Bryan's staff are working together, and it's at the Pinnacle Bank, and that's all that I know of right now. Anybody else want to add more to it?
I was just going to say that might be a question that the health department would be able to better answer. We just know kind of what we're doing with that. And then the other clarifying question was, did you say there would be 3 sites in Omaha and 1 in Lincoln? Yes, those are our specific CHI Health sites. Julie, do you want to explain that or clarify?
Yeah, correct. So we will have, just to go into a little bit more detail until we actually finalize, I want to share the locations, but there'll be 1 in the Mercy area in Council Bluffs, 2 in Omaha, and then 1 in Lincoln.
All right, thank you. And the next question is, phase 1B includes those with health conditions or those who are considered high risk. The CDC says smokers are considered part of this group. Does the CHI Health System know if this is accurate for Nebraskans who smoke? Will they be in phase 1B? And if so, can you provide reasoning for this? I don't know which one of you wants to take this one, Dr. Ward or Julie.
I'm not sure if they've been included or not yet.
Yeah, we could validate and follow up on that question.
Okay, the next question was about the 3 sites in the Omaha area, which we're not quite ready to share yet, but we of course will when we can. Let's see here. Sorry guys, there's a lot to read. If I'm a CHI Health patient, should I wait for the health system to contact me for an appointment or go ahead and register on a county health department site or the upcoming state site? Julie, do you want to take that?
I would recommend going ahead and registering. As Dr. Ward mentioned earlier, we're collaborating with the county and the state, so I would recommend going ahead and doing that. And then for updates from CHI Health, referencing our website to get the most up-to-date, to see if anything's changed in our collaboration with them according to the plans that we're rolling out. So that's where we'll have that information up to date for you, but I would recommend going ahead and registering.
Okay, awesome. Let me see, I think that was all I had. Oh, one more in the chat. Will one of the Omaha area sites be in Sarpy County? Julie, can we share that yet?
We know Sarpy County is really important, so that's been a consideration as part of our plan, yes.
Dr. Robertson, does CHI Health have plans to take part in other phases of the vaccine rollout aside from phase 1B?
The short answer is yes. We'll do whatever is necessary or asked of us by the state and the local county health departments. But we also are preparing that this COVID vaccine is going to just be part of what we do on an ongoing basis. So, I mean, I don't know that any of us, I know we've said this before, we're expecting that COVID will be around for a long, long time. And as long as COVID's around, so will the process of vaccinating people to give them immunity to the virus. For all we know, this COVID vaccine may become like an annual flu shot, right? We don't yet know that we won't be giving boosters on some sort of regular basis, maybe every year, maybe every 5 years, who knows? So we're prepared and planning for a future that will include continuing to provide COVID vaccines to those that are at risk.
Last question I have in the chat here. Is there information you know about these new vaccines that have the live virus? Those who are considered high risk, should they be getting a certain vaccine? Dr. Robertson, do you want to take that one?
I don't know, because the other two vaccines that are supposedly in the pipeline haven't been through the EUA process. I don't know that I can, wouldn't be safe for me to answer that question at this point. That data, there'll be all sorts of information that'll come out when they apply for emergency use authorization, and we'll be better able to answer once that data is made public.
We're right at the half-hour mark, so as we wrap up today, I'll let you guys just kind of share your closing thoughts on where we're at with phase 1B as we plan ahead. Dr. Robertson, we'll start with you.
Just encourage people to continue to not let their guards down, even though the vaccine is now getting ready to roll into phase 1B. To also, for patients that are already established with CHI Health physicians, our patient portal, our electronic record, we'll use that tool to be able to proactively communicate with folks when the vaccine is available, when people can sign up to make appointments, that kind of thing. But just to be patient, we're within a few weeks of being able to start vaccinating more broadly across the community, which is a great sign and a great step in the right direction.
Dr. Ward?
Yeah, well, thanks for joining. Thanks for listening to us today. Just again, really proud of our efforts around vaccination. We are ready to administer as much vaccine as we can possibly get. We have the leadership, the infrastructure to do it. It's a very complex process, especially with the Pfizer vaccine, for example, and all the requirements. I just want to give my thanks to all the work of the pharmacy team, nursing team, and others and our performance excellence people for putting all this together. One other just quick thing about masking. I know there's a lot of press about masking, a lot of strong opinions for those before the vaccine and after the vaccine. I was talking to officials today at Children's Hospital. They have seen 0 RSV, respiratory syncytial virus. It's a very common illness all over the place usually this time of year. We're seeing almost no influenza right now, unheard of this time of year. And it's the effect that masking is having for the overall health of our society is probably been a very beneficial thing for all of us anyway. So.
Thanks, Dr. Ward. Julie?
I echo what Dr. Robertson and Dr. Ward have said. I too want to thank the state, the counties, our community partners, and our teams. It's just been incredible to see all of these groups coming together to take care of one another, and we're really excited to see our patients here, hopefully here in the next couple of weeks. So appreciate the collaboration.
Awesome, thanks. And I did just want to mention, we know that there's a lot of questions out there about the vaccine, and as our team here explained, it's changing by the minute. So we do have an updated website. It's chihealth.com/vaccine, and that is where we're going to be posting all the very latest information that we have as a health system. So if you guys could help us get the word out about that link, that would be awesome. But thank you everybody for joining today. I will send the link